Paris, Chicago's major COVID restrictions are about to be lifted. On Monday, the city will end its indoor mask mandate. Plus, restaurants, fitness centers, and bars will no longer require customers to show proof of vaccination for entry. Joining us now with more on this is Chicago Department of Public Health Commissioner Dr. Allison Arwady. Dr. Arwady, thank you for fitting us in again, as always. Now, you've said that you are dropping the mask mandate to line up with the state, but why also drop the proof of vaccine mandate?
So the reason we put the proof of vaccine requirement for higher risk settings was because we were seeing our hospital system get threatened. We had more people hospitalized with COVID during the Omicron surge than we did at any prior point here in Chicago. The great majority of the folks hospitalized were unvaccinated. And so I had a lot of concern about having folks who we know are the highest risk of putting that burden on our healthcare system, being in settings that we know are, can be more of a concern. So it was never intended to be a long-term, but it was something to help us get through Omicron and help the hospitals get through. So now that we're hitting our metrics again for being back in that lower risk status for hospitalizations, ICUs, as well as cases and positivity, the risk is lower for everybody, and it is okay to be dropping that requirement at this point. Of course, we still encourage everybody to get vaccinated.
Now, the CDC recommends mask mandates in places where COVID transmission is high or substantial. And with the city's data as of yesterday, we're still at a substantial transmission rate with cases. Why go ahead and make the call to drop the mask mandate before that risk of transmission is a bit lower?
Yeah, so really, I expect the CDC will be updating the metrics for what we're looking at in a more long-term way. Just over these last couple of months, as we've seen so much more availability of the at-home tests, it's been harder to just make decisions based on cases or even positivity. We're doing a lot more testing of asymptomatic children in schools. There's a number of things that have really changed. And so the fact that we're seeing still, we're between 200 and 300 cases a day, which is very good compared to the 10,000 that we were seeing at the peak. And our positivity is all the way down to 1.5%. If our positivity were still sitting at 5, 6, 7%, we wouldn't be able to be there. But knowing our positivity is that low, we'd said we needed to hit 3 of our 4 metrics for cases, positivity, hospitalizations, and ICU. We've hit the 3, and the cases continue to downtrend. So we may even hit that one by Monday. But I was very confident based on the direction things are going and generally the risk overall that we are in the same place from a risk perspective as we were even, you think back to early last spring where we were able to drop the requirements. We're there again.
Now, businesses, can they still decide on whether or not they want to keep a mask or a vaccine mandate? And what kind of advice do you give to those businesses in making that decision?
Yes, absolutely. And I do want to be clear, there will be settings that masks remain required. Transit, hospital settings and healthcare settings, long-term cares, et cetera. But yes, we do expect, and we've already seen certain businesses and certain settings make that decision, and we're fully in support of that. We know that settings are going to be different. If you're a setting that serves a lot of older people, maybe a lot of them are not vaccinated, and you've already, things have been going well using some of those requirements, we fully encourage people to continue doing that. It's just that we don't need to require it at the city level for everybody when we're at this low risk setting. So I think, we've been giving guidance to lots of individual settings. We're happy to do that, but we're in full support of any setting that does decide to continue it.
And of course, there are settings where it is still required, schools, for example, but there are also people like the immunocompromised. What advice do you have to those folks to be sure that they're still protected?
Yeah, so when we drop the requirement at the city level, it's based on the risk that you're going to encounter somebody with COVID, in gatherings of a certain size through the day. And when that risk gets down to the point where it is now, the risk is quite low, but it is not zero. It will never be zero. So for folks who are immunocompromised or for, I know the young children have still not had that opportunity to get vaccinated. I know that's harder for people. We know there will be plenty of people continuing to wear masks, and we, at an individual level, certainly encourage that and support that. I don't want to see folks, calling people out for continuing to mask. And again, there are some settings that we know are higher risk that will be making that decision. But I think, we're never probably going to eliminate COVID entirely. And I do think it's important that when the metrics show the risk is very low, that we do lift that. people who are higher risk should keep talking to the people they're getting with in, settings where you're getting together with a group, having the extended conversations, making sure those folks are vaccinated, et cetera. But in public, we're in an okay place.
Now, the BA.2 Omicron subvariant, so-called stealth Omicron variant, initially detected in Illinois earlier this month, but cases are still decreasing. What concerns do you have about either that or any other variant forcing us to roll back?
Yeah, so we continue to have really good data following variants and subvariants, and that's something we've set up during COVID, and I expect it will continue very much long term. The BA.2, that subvariant, has shown up differently in different countries. We really make decisions around mitigation based on the risk of encountering COVID, no matter what type that is. For me, the biggest concern would be if we were to see a variant emerge in the future, especially that vaccines did not work well against. Vaccines continue to perform absolutely amazingly well against COVID, and especially against those severe risks, the hospitalizations and the deaths. So my biggest concern would be if we saw a variant emerge where that was no longer true, we would have to really, think about acting fairly emergently. But otherwise, if folks are vaccinated and boosted and all the other things, then I think we'll continue to monitor. But when we are in a good place locally, it is appropriate to make that decision based on our situation here and now.
And we're almost out of time, Dr. Arwady, but while we've got you, before we let you go, I wanted to ask you about the CDPH's final decision to deny the permit for Southside recycling on the southeast side. Give us a sense of what led to that decision for you all.
Yeah, so we did a health impact assessment, which is a long engagement that was at the recommendation of the US EPA and done in conjunction with them, as well as part of the CDC and an environmental consultant. And really, we found that in an already overburdened community, there were some increased risks to the environment, to human health and quality of life, as well as a history of some problems with compliance with existing regulations. And so in that setting, we felt the appropriate course was to not approve the permit.
Okay, Dr. Allison Arwady, thanks as always for joining us. We appreciate it.
Thank you.